Good morning. Our Bronson Ask the Expert segment today. March is Colorectal Cancer Awareness Month, and Dr. Sridhar Chalasani from Bronson Colon and Rectal Surgery Specialist is here to share some information about colorectal cancer, including what colorectal cancer is, who is most affected, as well as screening and treatment options. Good morning, doctor. How are you?
Good morning. How are you?
I am doing well. So, what exactly is colorectal cancer?
Colorectal cancer is cancer involving the large intestine. Large intestine basically is comprised of the colon and the rectum.
And
So any cancer that comes in there, we group together as colorectal cancer.
how serious is colon or rectal cancers, and how deadly are they?
This is a pretty serious condition because it's the third most common cancer in the United States, and it's the second leading cause of cancer deaths in the United States. So it is unfortunately, it is fairly common and affects our country quite a bit.
Are there any particular individuals who are more at risk for getting colorectal cancer?
Yes, there is a slight increase in colorectal cancer in males when compared to females. African Americans and Native Americans are also at a slightly increased risk of developing colon cancer. Other individuals, such as those with a family history of colon cancer, and also if they have certain genetic conditions like Lynch syndrome or polyposis syndrome.
I've got a two-part question here for you. What are the risk factors, and what are the risk factors that we can control and which are not?
I'm glad you broke them down that way because there are definitely factors that you can control. First and foremost is diet. There's good evidence to say that diets rich in fruits, vegetables, whole grains decrease your risk for colon cancer. Diets that are high in red meats and processed meats increase your colon cancer risk. So eating a healthy, balanced diet is essential. There are also there's also evidence saying that if you're overweight, not physically active, also increases your chances of getting colon cancer. There's also some evidence saying that moderate to heavy alcohol use also contributes to developing colon cancer. And then the factors that you cannot change are, as you know, all of us get older, so that's something we cannot change. And as you get older, your chances of forming polyps and cancers increase. If you have a history of having had polyps yourself or cancer yourself, that puts you at a higher risk for developing more polyps and cancers. If you have a history of what we call inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, those conditions also put you at a higher risk. And the others are the genetic diseases that I touched on earlier, like Lynch syndrome or the polyposis syndrome.
Well, I was just going to ask, how do we detect colorectal cancer? Why is early detection so important in the outcome and recovery?
I'll first answer the question of why it's important to detect it early, because the things that we try to detect are both cancers and polyps. Polyps are the precursors for cancer, colorectal cancer. So by taking out polyps before they have a chance to turn to cancer, that's a huge plus. By taking out the polyp, you're not even considering a cancer. And when you talk about cancers, the earlier is a cancer is detected and treated, the greater the chances of survival and cure from the cancer. So not only is it, it's preventive, and also if you catch the cancer early, your chances of having a cure are much more likely. The ways that we detect colon cancers, there's different methods. The Gastroenterology Society typically recommends that you have a colonoscopy, and there are some other tests that you can do in the privacy of your home, such as a FIT test, FIT test. There's also a newer test called Cologuard, which looks for cancerous DNA, colon cancer DNA in your stools. And then finally, we have a CT scan. It's called a virtual CT colonography. It's a specialized CT scan that looks for polyps and cancers of the colon.
So when should we start thinking about being tested for colorectal cancer?
That typically depends on your risk level. If someone is at average risk, that means you don't have any family history of colon cancer, you don't have any history of polyps or colon cancer in yourself. We typically start testing them at age 45. We previously used to do them at age 50, but because we are seeing more and more people with younger folks with polyps and cancers, they recently changed the recommendation that we start testing at age 45. And then depending on the test that you do, the interval of the test varies. In folks that are at a higher risk, such as some of the conditions that I mentioned, family history of colon cancer, personal history of colon cancer, polyps, ulcerative colitis, Crohn's, and some of the inherited diseases, they would typically start earlier, depending on the condition, and the frequency will also depend on what's found during these tests.
And what should someone do if they are concerned about colorectal cancer or have more questions?
The best thing to do is to talk to your family doctor about this. They are the best source for the information. They will guide you on the ideal screening option for you. The important thing is to get tested, whether you do the simple home-based test or you get a colonoscopy. The important thing is to be tested because some kind of testing is better than no testing.
All right. Dr. Sridhar Chalasani is a physician at Bronson Colon Rectal Surgery Specialist. He sees patients in both Kalamazoo and Battle Creek. And I want to thank you so much for joining us this morning, Doctor.
Thank you for having me. Have a good day.
You as well.